Hello everyone and welcome to our virtual educational program. In this module, we will be discussing long-term care facilities. For some, at a certain point, support from family, friends, and local programs may not be enough. People who require full-time help and assistance might move to a residential facility that provides many of the long-term care services they need. However, deciding whether a long-term care facility is the best option for your family and selecting which kind you would most benefit from is a complex process. Additionally, both paying for long-term care facilities and determining the quality of care can make the challenging situation even more complicated. Payment, for instance, is a major limiting factor in long-term care choices. For many families, assisted living facilities are prohibitively expensive. The issue of how to pay for long-term care and figuring out what is and isn't covered by Medicare or Medicaid is a huge element of the decision. Additionally, the cost of care varies greatly depending on the level of care needed and the location of the facilities. According to a 2021 cost of care survey, the median monthly cost for an assisted living community is $4,500, totaling to $54,000 annually. Skilled nursing homes, which provide greater medical support and assistance than assisted living communities, are more expensive. In fact, the average cost is $9,000 a month, which adds up to approximately $110,000 per year. Facilities also don't look or feel like they used to, thanks to the coronavirus pandemic, which brought major changes to long-term care. Coronavirus outbreaks in nursing homes forced drastic changes in infection control measures, resident activities, and visitor restrictions. Although this is a complex process, with many concerns to address, the combination of in-home caregiving and community services may no longer meet an individual's changing health, safety, or personal care needs. In this video, we will go through the types of long-term care facilities to better inform you of what is available. There are 8 major types of long-term care facilities. Assisted living facilities offer services such as medication management and light personal care within a supervised setting. Housekeeping, prepared meals, and assistance with daily personal care are available to residents. Assisted living is known for its community-based approach, with a focus on group and individual activities, and efforts by staff to prevent residents from feeling isolated. Assisted living also has different levels of care that someone would buy into. For example, for residents who need lighter care, they may opt for medication management, check-in services, and morning assistance in getting out of bed and showering, while others who require more assistance may opt for additional services. The biggest difference between independent living and assisted living is that assisted living communities have all-day support on site, which means that it can be more expensive than independent living. With assisted living, you should really understand what is covered. For example, how often services are provided. If they provide meals, is it one meal a day? Is it weekly? Is it daily housekeeping? If they say that they provide transportation, what does that mean? And are there any additional charges? Nursing homes provide a wide range of health, medical, and personal care services beyond what is available in assisted living facilities. These facilities typically include nursing care, 24-hour supervision, 3 meals a day, and assistance with everyday activities. Most residents here have chronic physical or mental health conditions, or both. The terms skilled nursing facilities and nursing homes are often used interchangeably, however they are not identical. Skilled nursing facilities are more likely to have a consistent presence of nurses or physicians and offer rehabilitation services such as physical, occupational, and speech therapy. As such, skilled nursing facilities and nursing homes fall under different sets of regulations. To qualify for a skilled nursing facility, an individual should need a lot of assistance. Typically, they would require the assistance of 2 individuals to move them. They are bedbound, and they have other skilled care needs. For example, someone who has a disability or chronic medical care such as dialysis or a tracheostomy tube may benefit from residing in these facilities. For people with Alzheimer's disease or other types of dementia or serious memory problems, memory care involves an extra level of care and supervision. They offer a safe, structured environment with more gentle sensory stimulation that people with dementia can benefit from. They are similar to assisted living, but they are secure for patients with dementia who are at wander risk. Secured memory care units are often located within many nursing homes and assisted living facilities. Staff members receive special training to provide 24-hour care and daily assistance to this group. It is important to note that memory care typically costs more than non-memory care. Continuing care retirement communities, also called life care communities, offer different levels of service in one location. Many of them offer independent housing, in the form of houses or apartments, assisted living, and skilled nursing care, all on one campus. The advantage of continuing care retirement communities is that the resident only has to make one big move into the community, and from there, depending on their needs, they will transition into different levels of care. However, with this convenience comes a significant financial investment, with upfront fees and monthly charges. Independent living, also known as retirement living. These are independent living communities primarily focused on serving the social needs of residents. Retirement living focuses on a self-sufficient lifestyle for individuals. Such communities offer some social outings and group events that residents can take part in if they wish. These communities are lifestyle-focused and typically do not offer meals or healthcare services. For military veterans with medical conditions that meet the nursing home level of care, the Department of Veterans Affairs oversees its Medical Foster Homes program. These facilities are like adult family homes, in that they are private homes with trained caregivers who provide support to a number of people. Medical foster care represents a good option for veterans who need nursing home care but do not want to be in an institutional setting and would prefer a place with fewer residents. For these facilities, veterans are responsible for paying for the care they receive, either out of pocket or via long-term care insurance, VA aid and attendance pension benefits, or another applicable benefit program. And lastly, adult family homes. Also known as group homes or residential care homes, these neighborhood-based facilities are run by licensed caregivers. They usually have far fewer residents than nursing homes, perhaps 4 to 10 at a time. However, unlike nursing homes, they do not offer any medical or skilled nursing coverage. Instead, one may reside in an adult family home because they need care with their day-to-day activities of living, such as eating, bathing, dressing, and toileting. Overall, they are described as assisted living, but in a much smaller setting, with around-the-clock caregiver support on site. Planning for the rest of your loved one's life is challenging, but the sooner you start to gather resources and understand what is available to you, the better you will be able to make an informed decision. Learn what Medicare and Medicaid cover, as well as whether long-term care insurance, if you have it, can be applied towards living facility costs. Additionally, before you make any decision about long-term care, talk to someone you trust to understand more about the long-term care services and supports. You may want to talk to family, your doctor or other healthcare provider, a person-centered counselor, or a social worker. Thank you for your attention during this presentation. We hope the information provided was helpful to you.